We told you earlier in this newscast about a public meeting that was held today at the Iowa Board of Medicine. The board is trying to get clarification regarding just how to practice Iowa's new abortion law should it go into effect. Specifically, doctors want more details about rules that need to be followed in order for them not to be disciplined. WHO 13's Amanda Krenz spoke to a Metro physician who shares how the law would impact her practice.
I am joined now by Dr. Francesca Turner. She is an OBGYN in the Des Moines metro area. Dr. Turner, thank you so much for joining us today. The Iowa Board of Medicine had a meeting today. The purpose of the meeting, from what I understand, and maybe clarify if you need to, was to discuss the new abortion law in Iowa that is currently being blocked. But there are certain rules that are falling under this law that the Iowa Board of Medicine is wanting to discuss. As a practicing OBGYN, if you can just talk first of all about your thoughts as a physician regarding the law.
So the law that was passed by the legislature that is currently enjoined has already been passed. And so that is set. But what the Board of Medicine met about today was the rules on how to discipline a physician, or what rules we need to follow in order to not be disciplined. And so what that means is, if I, as a healthcare provider, give someone life-saving care, at what point am I breaking law or not? And so an example would be if someone were to come in to our emergency department and miscarrying with an embryo that had a heartbeat. At that point, how much blood did they have to lose before it becomes life-threatening? And usually as a physician, if there is an inevitable miscarriage or they're continuing to bleed, I would like to perform a procedure to save their life before they need ICU level care, before they need a massive transfusion protocol. And so that's really, the law is kind of vague, and these rules are supposed to help try to clear that up so that I can give my patients the medical care that they deserve.
In this discussion with you, my goal is to really leave politics out of this, leave pro-choice, pro-life out of this. I'm strictly talking to you today with you as a physician who has looked at these rules under the law and how they will apply to you in your practice. Do you feel like there needs to be more clarification?
I do. So some of the rules that they're proposing want us to, quote, determine if the sex act constitutes a rape. And again, as I've talked about before, I'm not an attorney, I'm not a judge, and there are judges across this country that will argue about what constitutes a rape. My job as a physician, and what I've been trained to do, is give people compassionate, non-judgmental care. I'm not an investigator, I'm not an attorney, I'm not trying to figure out these details, and they actually ask us, or are asking us in the rules, to find out details such as the time and date and location of the rape or the incest. And those are not pertinent medical questions, and those are not things that I normally do. And so I think it's unfair that they're asking us to do things outside of the usual practice of medicine.
I was just going to ask if you feel as if it is outside of the scope of what you're professionally trained to do. The law, meaning the law,
yes.
And the rules.
So they, again, like I said, they're asking us to act as interrogator or investigator, and that's not what we do. That's not how we take care of patients, and it's very intrusive into the patient-physician relationship.
We could talk about this for hours, but we have seconds left in our interview today. What do you see moving forward from this as far as the Iowa Board of Medicine goes and their input with the rules under this law?
Well, I think the Iowa Board of Medicine was put in this very difficult situation to try to make these rules based on legislation that's already passed. And hopefully they're going to do the best they can with the situation that they're in.
All right, Dr. Turner, thank you so much for your time.
Thank you.
That was our Amanda Krenz. Iowa's new abortion law was passed last July. It was blocked a month later. So right now, abortion is legal in Iowa up to 20 weeks.